Furniture. We also have a standby delivery van for your express delivery. The Redemption Furniture in the city.
Tonight, NCDC to test 2 million people for COVID-19 in the next 3 months as confirmed cases increase daily in Nigeria. Edo State government establishes testing centers at its boundaries. Chief Judge continues jail delivery to check spread of COVID-19. And also tonight, Uniben unveils manufactured ventilator.
Ventilators have offered best chance.
A very good evening to you. You're on to the news at 7. I'm Ogochkuka Ona. As at 11:20 in the evening, Monday, 27th April, Nigeria recorded 64 new cases of coronavirus, bringing the total to 1,336. Those discharged are 255, while 40 patients have died. The new cases were reported in Lagos State 4, FCT 15, Borno 11, Taraba and Gombe 2 each. This is according to the Nigeria Center for Disease Control, NCDC. Meanwhile, at its daily briefing this Tuesday, the Presidential Task Force on COVID-19 says NCDC plans to test 2 million people for the disease in the next 3 months in a ratio of 50,000 per state. And back home, Edo State has recorded 29 confirmed cases of coronavirus. Out of these are 3 deaths and 8 discharged. There are 234 suspected cases, 326 persons of interest, and 420 contacts line listed. As at 11 o'clock this afternoon, the previous 25 confirmed cases are spread across 7 local government areas of the state. They are Oredo 13, Esan West 4, Ego 3, Ovia North East 2, Ikpobauka 1, Wonde 1, and Esako Central 1. And similarly, Edo State government has put in place testing centers at the various boundaries, serving as entry points into the state. This is among other measures taken by the state government to further check the spread of COVID-19. Uloke Naini reports.
The state government has decided to open an additional screening center across 18 local governments and border entry into the state, especially the border with Delta, Ondo, and Kogi State. This is aimed at guiding against importation of the virus from these states and preventing community transmission.
As at 27th April 2020, the total number of suspected cases for COVID-19 in Edo State stands at 254, with 29 confirmed cases representing 11.4%. 194 of these suspected cases were confirmed negative, representing 76.4%. Case fatality rate stands at 10.3%, translating to 3 deaths. So far, a total of 8 persons have been discharged, amounting to 27.5%. The State Commissioner for Health, Dr. Patrick Okundia, who explained the health conditions of patients at the various isolation centers says there are 326 persons of interest in the state, out of which 105 have exited follow-up.
We have 29 confirmed cases, which amounts to 11.4%. Total active cases currently under treatment in Edo State is 18, and this is distributed as follows. We have 9 of these cases in Stella Obasanjo Hospital. We have 3 in receiving treatment at the University of Benin Teaching Hospital, and 3 also receiving treatment at the ERA Specialist Teaching Hospital. 3 of course are under self-isolation. As we speak, all our active cases are stable and they are responding to treatment.
For Dr. Andrew Obi, who is an incident manager and member of the response team, the latest steps taken by government, which involve screening and testing, will present the true picture of the pandemic in the state.
Surveillance is the bedrock of the entire COVID-19 response. We should be able to identify these people wherever they are. We should be able to assess them and find out those persons who meet case definition for testing.
Other members of the response team in charge of other subcommittee gave their reports. The response team urged citizens of the state not to entertain fears as government is on top of the situation. In Benin, Goodluck Enaini, NT News.
Goodluck Enaini there. In the meantime, President Muhammadu Buhari Monday signed the proclamation order on the general management of COVID-19 in Lagos, Ogun, Kano, and the Federal Capital Territory and other states in Nigeria, as contained in its nationwide broadcast on April 27, 2020. A statement on the media by the Special Advisor to the President on Media and Publicity, Femi Adesina, indicates that it is in exercise of the powers conferred on the President by Section 3 of the Quarantine Act Q2 laws of the Federation 2004 and all powers enabling him in that regard. And now joining me in the studio is a consultant family physician from the University of Benin Teaching Hospital, Dr. Osaze Obaze. A very good evening to you.
Good evening.
Thank you for joining us. All right, we've been following events as they come, especially now that we're having community transmission and rapid testing. So it seems to be helping a lot in curbing the spread. How do you encourage more people to go for testing?
Well, it's a bit complicated. On my way to the studio here, I was listening to a radio program, and someone called in. This same question you asked was brought up, and someone called in and made a suggestion, and it was like the turnout has been a bit low, so that how do you mobilize people? And he was suggesting the palliatives the government is giving out, maybe food items and all that, that if you had those things at the centers, okay, and you say come and do your test or you come and do your screening, you get maybe a small bag of rice and gari or indomie. A lot of people are hungry, and you give these palliatives out, that it might make the turnout increase a bit. It sounded funny, but it made some sense. Yeah, it made some sense. I mean, the government is looking for how to give out these palliatives in a good way. Now that can be what you do. It's like what they do with the WHO for immunization. Sometimes you go out, you tell the mothers, you come back, things as small as indomie, you give them, bring your children for immunization, and when you come, you give them indomie or something. And we know the way as society and our settings are, it will help to motivate people to come out. That is one thing. The other thing is continuous education, letting people know the importance of getting tested and encouraging them.
Okay, Doc, I want to go back to that. you are suggesting also, according to the caller on the radio program, that people should, be motivated to go for testing. Should it be so? I want you to, say it authoritatively. Should it be so? Is it not our personal lives? I mean, it's like salvation now, for instance. Is it not personal?
Well, I think we're having a little bit of challenge here because whereas in the Western world, in developed countries, you're having a lot of mortality, it's affecting them a lot. It's not quite the case here. So we still have a challenge. I mean, I still encounter people every day who are asking if COVID is real. Some people feel it's a ploy of the government to eat money and all that. So when things don't really impact the populace directly, there can be that challenge of mobilization. And I think it will help, really. If the government was to try it now and institute palliatives, no matter how small, food items
at the
testing site, I tell them, you go there, do your test, and you get this, they'll be overwhelmed.
Okay, but the little number we've been having, I think it's making an impact because we're having cases reported daily.
You're having cases reported daily, but like you just showed with the committee, I think they really have to be clear about what they want. Do you want people who don't have symptoms to check, to come and test? I stopped by one of the places to find out, as I was driving past, to find out what they were doing some time ago, a few days ago, and I discovered it's like the doctor was saying that they are trying to use a case definition for testing. So I think they really need to come out and be clear about what they want to do. So if I don't have any symptoms at all, can I walk there and get tested? What they told me, the person who told me, was more like if you have some symptoms or you're not feeling too well, and I think they have some criteria that you have to meet to be tested. So is that the case scenario, or anybody can just walk in and say, well, I want to know my status. Do I have COVID or not? So I think this committee really has to come out and be clear. You get, because like the report just before I came on, I heard the doctors talking about people meeting the criteria for testing, which was
so there
in
are
cognizance, yes, which was in cognizance or corresponding with information I got when I stopped there. So it's like there's a case definition. So is it people who have symptoms, or anybody who feels well can just go there and want to find out their status? So I think they really have to be clear about what they really want.
Okay, so as a family physician, I'm suspecting that schools may be resuming soon. What should be in place before our children go back to school?
Well, it's a bit complicated because I think we are going through a phased approach towards the relaxation of the restrictions. Actually, I think one of the last things we should go into should be lifting of the number the number for gatherings. As it stands, I think it's 20. Now the challenge with the schools, it's a new virus. I mean, we are getting things every day. Just today, UK is talking about a syndrome associated with it in children. Up until now, children and adolescents were not high-risk group. They seem to be protected for some reason which we don't know yet. So you hardly found children coming down with it. I'm sure all over the world, mortality among children is extremely low. That being said, you want to think that the children are safe. You shouldn't panic too much as long as you have all the hygiene methods. But with the schools resuming, there's a lot of impact on the society. Traffic goes up. People are moving. The traffic in the whole society is more. A lot of parents are now moving for school run and all that. So it affects the general population somehow. I mean, when the schools are on holiday and you're driving to work, you see the roads are free. On Monday morning, everybody rushes to school. You see, so I think it has an impact on the general society. I think generally, whenever the government decides it's appropriate to get the schools back, we'll have to follow the general measures. The worry I have is about the public schools. A lot of the private schools might be able, first of all, they are not very crowded. They might be able to institute measures to control social distancing and all that. But my worry is the public schools. How are we going to be able to cope? with that. So I think it's something they need to put into consideration whenever they decide it's the appropriate time.
Okay, so lastly, how is COVID-19 affecting family physicians, you especially now at work and in your home?
Well, for family medicine, we are the primary care physicians. We are the first point of care. So in UBTH, you have the general outpatient department under the control of the family physicians, which means generally there are two entry points into the hospital, either the emergency or the general outpatient. For the family physicians, it's quite critical because we have undifferentiated cases, and all the people coming in with fever is the commonest symptom or complaint we have there. Cough, upper respiratory tract infections, sore throats, and all that. These are symptoms of the coronavirus illness. For us, we meet these patients first up, and it's very challenging, especially as we approach the rainy season, because somebody comes with fever, somebody comes with cough. Those are symptoms of corona, but you have to be able to delineate and get information, get a history. So it's a bit challenging. Yeah, and we have to be on our guard because we are the one who will alert that this is a suspected case and get the appropriate departments or response teams involved. So it's a bit challenging, but by God's grace, we are being able to.
Yes, you must surmount. Yeah. It's called to duty. All right, thank you very much, Dr. Saze Obaze, consultant family physician from the University of Benin Teaching Hospital.
Thank you so much.
It's been a pleasure having you.
All right, thank you so much.
All right, you're still on to the news at 7. We'll now take a break. Please stay.
My people, make una listen o. With government for Edo State, one make sure say all of us know how our body dey for this coronavirus wahala. Starting from Wednesday 22nd April 2020, our health workers go start wetin dem dey call mobile post screening for coronavirus, and na for all the 12 wards for all the local government. I beg, make una cooperate with all health workers. This mobile post screening na the same one wey dem don dey do for some health centers. Abeg, make all of us try stay for house, and if e come be say we must enter town, make sure say we wear face mask and make we dey wash our hands with soap and wey dey flow. Abeg, make we no near people. Remember say curfew dey for Edo State from 7 p.m. to 6 a.m. Call these toll-free numbers if you get any issue: 080-0123-5111 and 080-022-00110. This coronavirus, we go get over am. Edo State government bring on this message.
Coronavirus special message by our caring individual, Engineer Chris Ogimoyi, FNSE, JP. As Nigerians battle with the coronavirus pandemic, it is necessary for us all to adhere strictly to the guidelines recommended by the federal government of Nigeria and World Health Organization so as to stop the spread of the disease. Stay at home except you are an essential worker. Maintain the social distancing rules. Always wear face masks whenever you want to leave your house. Always cover your mouth and nose with tissue paper whenever you want to sneeze or cough. You can use your elbow when tissue paper or handkerchief is not available. Throw away used tissue paper in the waste bin immediately. Wash your hands with soap and running water and use alcohol-based hand sanitizer regularly. Report any person with symptoms of the disease to authorities concerned. Stay at home. COVID-19 is real. This message is brought to you by an individual with a caring heart. Engineer Chris Ogimoyi, FNSE, JP. Coronavirus special message by a caring individual, Princess Rosemary Osulatu, founder, Rosula Foundation. As Nigerians battle with the coronavirus pandemic, it is necessary for us all to adhere strictly to the guidelines recommended by the federal government of Nigeria and World Health Organization so as to stop the spread of the disease. Stay at home except you are an essential worker. Maintain the social distancing rules. Always wear face masks whenever you want to leave your house. Always cover your mouth and nose with tissue paper whenever you want to sneeze sneeze or cough. You can use your elbow when tissue paper or handkerchief is not available. Throw away used tissue paper in the waste bin immediately. Wash your hands with soap and running water and use alcohol-based hand sanitizer regularly. Report any person with symptoms of the disease to authorities concerned. Stay at home. COVID-19 is real. This message is brought to you by Princess Rosemary Osulatu, founder Rosula Foundation. Rosula Foundation wishes you safety during this pandemic. Observe all local and national precautions. The best prevention is staying at home.
Next time you visit the ancient city of Benin, two things will excite you: the warmth and welcome of its people, and of course, the class and style of its hospitality business. Randeki Gold, home of hospitality like no other, located in one of the most serene environments in the ancient city, truly classy and exquisite with world-class facilities. Fully equipped digital multipurpose hall with life-size, ultra-high definition LED screen, 180 square meters king-size swimming pool with bubble bath, enough to leave you breathless. The exotic Ariel's Bistro and Grill restaurant with variety of continental dishes, especially some of the rarest delicacies you can find in town. Fact is, a visit will truly convince you that we are gold. Randeki Gold is the gold wing of the prestigious Randeki Royal Hotel at 6 Henry Street off Ihama and Boundary Roads, GRA Benin City. www.randekihotels.com. Randeki Gold, our hospitality is gold.
34 inmates of the correctional centers in Benin have so far been released by the Edo State Chief Judge Esther Edegin. This follows the federal government's directive for the decongestion of such facilities to curb the spread of the virus. Elizabeth Omoko has details.
One of the cases which suffered setbacks at the Benin Custodial Center was that of a commercial driver, Lucky Elum, who has been in custody for 23 days for overtaking a one-star security officer along Sapler Road. Another is a case of Samson Umbuko, reprimanded for unlawful possession of a generator.
He was in the Helios. So because he overtook him, he said, yes, ma'am. What were you driving? Was
the Chief Judge ordered their release unconditionally and directed the DPP and OC Legal to release the vehicle and generator to them within 24 hours. The Chief Judge also gave the OC Legal until 4th of May to provide answers to the case file of one Gaspar Igarewa, who was arraigned in 2016 for alleged conspiracy, kidnapping, and demand for ransom. On medical grounds, 20-year-old Kingsley Phillips, who developed partial blindness and sensory ataxia within his 2 years, 8 months, and 21 days stay in custody, was discharged without conditions, while 6 inmates having psychiatric issues were referred to the state for treatment, while they are being secured at the center.
This is Benin Correctional Prisons, day 2 of the prison decongestion exercise. Inmates who are terminally ill, who are aged, and who have no case file were discharged. And we also have those who have served more than the prison term required, the punishment required in the criminal code. Those were the people also discharged, and I'm satisfied with what we have done today.
We commend the efforts of the Chief Judge in ensuring the adequate use of non-custodial methods of treatment of offenders towards the decongestion of the custodial centers in the state.
A total of 11 inmates were released at the custodial center. 2 others were also released at the Medium Security Correctional Center, totaling 13. This brings the total so far to 24 inmates released in Benin City. In Benin, Elizabeth Omoko, NTA News.
The University of Benin has unveiled a ventilator produced using locally sourced materials by its engineering and medical sciences departments. It is in response to the global race to produce some of the equipment and the items in the management of coronavirus pandemic. Ivie Oyakire reports.
Breathing process on the event of a failure of the lungs as a result of disease infection. It is used to push air to the lungs. Ventilators have offered best chance of survival for patients with worse effects of coronavirus. To ensure its availability, as even developed countries are faced with the challenge of getting sufficient ventilators, and to ensure that Nigeria is not left behind in the struggle, these researchers came up with the COVID-19 initiative, with the manufacturing of a mechanical ventilator that works without electricity for at least 1 hour. It is also designed to function in a dual mode for adults and children.
Ours is very portable, robust, and it's relatively cheap compared to importing. And if government can take this opportunity to partner with us, we can produce close to 20 a week.
Having done their part of manufacturing, the end users assess the benefits.
If we need IPPV, which is intermittent positive pressure ventilation, this is just adequate. It can work without oxygen, using room air. That is a huge advantage.
The Vice Chancellor of the university, Professor Lilian Salami, is not surprised as the school is always writing its name in gold.
This is a reactive expression of the need for us to actually deal with the pandemic that is facing us. And I know that the crop of professors, researchers that we have in the university, no doubt will live up to the expectation. This is a research that will be nationally, internationally embraced, more still that it has local content.
I will also be advocating that government should partner with the university system. There are solutions to all problems within the university system.
Meanwhile, the university has since commenced the production of hand sanitizers and liquid soap to check COVID-19 pandemic. In Benin, Ivie Oyakire, NTA News.
About 900 families will benefit from COVID-19 relief packages donated by an individual, Julius Irumudomwan, to the APC secretariats in Esan West, Esan Central, and Igweben local government areas. This is to cushion the effects of the lockdown on the vulnerable in the various communities. Anwuli Okolo has details.
The palliatives were made up of 905 kg bags of rice, 300 bags each for the 3 local governments. First point of call was the APC Secretariat in Epuma, Esan West local government.
I'm presenting this 5 kg bag of rice to the chairman of the party of APC in Esan West.
And then Irua in Esan Central and Igweben local government.
The relief package, 5 kg bag of rice.
For Mr. Julius Irumudomo, the inspiration to contribute came from advice of friends to assist in providing relief for persons affected by COVID-19 in his hometown. Though in absentia, his eldest brother and wife decided to help him carry out his dream to help cushion the effect of the lockdown on his people.
My brother who did this thing, they're still battling the same COVID-19 in the United States. He just want to help his community people.
Only the government cannot help. What we are doing is very small, but it's going to put a smile in somebody's face.
The party leaders, while commending the gesture, promised to pass down the bags of rice to the vulnerable in their various units through the ward leaders.
We receive this palliative from our brother who has deemed it necessary to remember his people at this difficult time.
We are glad there are 300 bags, so they will get that to the units.
We will distribute it evenly, especially to those downtrodden.
To look back, I remember he saw people at home. I believe he has done well.
Other individuals with means should also complement this effort. It is just the only way to tell the people that they care.
The donor, Mr. Julius Irumudomo, hails from Epoma in Esan West local government. He is a businessman and chairman Roadmap Construction Company. From Igweben, Anwuli Okolo, NTA News.
It's time for another break. Please stay with us.
Coronavirus, also known as COVID-19, is one of the most deadly diseases which has infected over 2 million people in the world right now. The good news is that we can stop the spread if we do the right thing. Wash your hands frequently with soap under running water. Avoid gatherings and physical contact. Prevent coronavirus by cleaning all surfaces frequently. Returning travelers to Nigeria, stay home and avoid contact with people, including family, for 14 days. For NCDC self-isolation guide, visit covid19.ncdc.gov.ng. My name is Chris Osaiti Neihari, State Public Secretary, PDP, Edo State.
The federal government has declared Friday, May 1st as public holiday to mark this year's International Workers' Day celebration. The Minister of Interior, Ralph Arabushola, on behalf of the federal government, commends Nigerian workers for their resilience, patience and understanding, and in particular their support for the present administration and its effort at stemming the spread of COVID-19. He notes that with the cooperation of every citizen, as well as strict adherence to the measures being put in place by relevant authorities, the challenges being faced by all as a result of the disease would soon be put behind. He wishes all workers a peaceful May Day celebration in advance. All right, that's our package tonight. Many thanks for watching. Good evening.
Praise the Lord. Hallelujah. Welcome to the hour of the truth of the gospel. God is here to bless you through the ministry of Apostle Harrison Charles, the servant and prophet of Jesus Christ in Dayspring Assembly Incorporated. We hope that you will prayerfully listen to the grace of this hour. May God bless you as you pay attention. Amen.
Of the gospel